Hello, my name is Darlene. I am doing a presentation and covering ADHD. My role for this assignment is role B, which means I will be covering the summarizing the article for ADHD. The article that I am summarizing is Understanding Attention Deficit and Hyperactivity Disorder from Child to Adulthood. And that article was retrieved from the National Center of Biotechnology. I will be covering the comorbidity of ADHD, diagnosing ADHD, the prognosis, the neurobiology, how genetics affect ADHD, the treatment options, psychosocial treatments, and pharmacology treatments. And at the end, I will offer some website resources for further information. On slide 1, the overview of ADHD. ADHD is a neurobehavioral disorder, which is the most common neurobehavioral disorder presenting in children. And ADHD is often comorbid with oppositional defiant disorder, anxiety, and mood disorders, as well as substance use disorders, including tobacco use. If left untreated, ADHD causes underachievement in academics, in careers. It causes difficulty with personal relationships, and it can also cause significant problems just navigating through daily living. Approximately 4 to 12% of children are diagnosed with ADHD. 4 to 5% of college-age individuals are diagnosed with ADHD, and adults are currently being diagnosed at increased rates, although the percentage is not able to be presented because current statistics show that adults that are diagnosed with ADHD, they're not, I guess they just don't have them in the statistics, and they lag significantly. The only thing they do know is that the percentage lags substantially behind those of children. On slide 2, the comorbidity. There are documented high rates of psychiatric and learning disabilities. Adults have a high rate of antisocial and conduct disorder for those who have ADHD, and anxiety symptoms are generally present in most ADHD diagnoses. And it's oftentimes a prominent symptom of ADHD, and it can manifest as social anxiety, general anxiety, and or panic attacks. ADHD increases the likelihood of having a depressive disorder by 2 times. So that's pretty fascinating that generally somebody with ADHD increases their likelihood of a depressive disorder. ADHD is often comorbid with bipolar, although there is controversy over the diagnosis excuse me, of ADHD and bipolar disorder together. Adolescents with ADHD are more likely to become substance users, and adolescents and adults that are diagnosed with ADHD become addicted to cigarette smoking at twice the rate compared to those that don't have ADHD. And on top of that, it increases the risk of subsequent alcohol and drug use. And those with ADHD are more likely to have severe substance abuses as opposed to those with their non-ADHD peers. And they also can or will be addicted statistically longer than their non-ADHD peers. On slide 3, diagnosing ADHD. Obviously, they must meet the DSM-5 guidelines, and just a quick overview of that would be inattention, difficulty sustaining attention, forgetfulness, easily distracted, fidgety, excessive talking, restlessness, impulsivity, and interrupting others. DSM-5 guidelines were created for those up to age 17, therefore adults may not always fit that same criteria. Diagnosis onset must be verified for children and adults, and the onset for adults must have been present in childhood and have also be showing with current symptoms. Diagnosis is made clinically by considering the patient's symptoms, the severity of the impairment, the possible comorbidity, the family history, and psychosocial stressors as well. On slide 4, the prognosis of ADHD. Data does show that over time, all symptoms of ADHD do not remain the same, such as hyperactivity and impulsivity, which both seem to diminish over time, but inattention remains present generally. ADHD affects organizational skills, complex problem solving, memory, and learning disabilities. ADHD impairs the ability to perform detailed tasks. Research has indicated abnormalities of the brain structure and function in the pathophysiology of both childhood and adult ADHD, which is quite fascinating. On slide 5, the neurobiology. ADHD affects the frontal circuitry of the brain, causing deficits in cognitive functioning. Imaging studies have indicated abnormalities in the brains of those diagnosed with ADHD, such as they have a smaller cerebrum, cerebellum, and the 4 cerebral lobes, which is quite fascinating. Imaging studies also show a smaller anterior cingulate cortex and dorsolateral prefrontal cortex than those without ADHD. The dorsolateral prefrontal cortex controls the memory and the ability to retain information while receiving new information, which makes sense with the executive functioning and the cognitive inabilities that are affected by ADHD. On slide 6, we have the genetics. I am so sorry. ADHD is among the most recognized genetic-based disorders in psychiatry. Children who have family members with ADHD are at a higher risk of developing the disorder themselves. Twin and adoption studies indicate a substantial ADHD genetic component. Environmental influences can also affect the vulnerability of ADHD genes that are associated with the environment. Genes that are affected by the environmental influences are dopamine, DRD4, dopamine transporter, SNAP25, and serotonin. On slide 7, we have treatment options, and those would be non-pharmacological, such as education, psychotherapy, support groups, resources, increased structure and predictable routines, educational adjustments, and home adjustments, which are very important. Children with ADHD do need a very structured environment. They need to know what to expect, and they need to oftentimes have lists so that they know what their daily routine consists of and what's expected of them. And then also we have the pharmacotherapy. On slide 8, we have the psychosocial treatments in more detail. That would be educational tutors. It could also, on top of tutors, be therapists or counselors or social workers. And what they do is they identify and help them understand their underlying emotions. They help them develop strategies to improve their academics. They also do skill building for interpersonal relationships, as well as organizational skills. As I was stating before, you oftentimes need to help children and adults with ADHD with very structured, detailed tasks so they know what's expected of them. Parent training. Parents who have children of ADHD often need support groups to help them be able to deal with what they need to deal with. And they also need to be taught how to role model for their children that have ADHD. Classroom accommodations, they would need preferential seating, which would help increase their attention. So the teacher could oftentimes give just, hand gesture cues to the children to try and keep them back on task. And it's best that you give children and adults with ADHD repetitive tasks as opposed to very fine detailed tasks to help them gain a better understanding. Cognitive behavioral therapy is another option for a psychosocial treatment, such as teaching them social skills and organizational skills. Again, it always seems to go back to lists and being very organized so that they know what to expect. The pharmacotherapy, which would be medication management, which is generally something that is done in the immediate to treat ADHD. And the medication management is the most important variable and outcome in context compared to multimodal treatment over the first year or two of treatment. This would indicate that even if you tried to do other forms of treatment, that along with medication, research shows that the outcome is better if they had medication to start with for the first year or two. Stimulants increase the dopamine and norepinephrine, which is generally the type of medication that's given for ADHD, stimulants. And then we have noradrenergic agents, which regulate levels of a neurotransmitter called noradrenaline. And then we have alpha agonists, which is a class of sympathomimetic agents that selectively stimulate alpha adrenergic receptors. I apologize, I may not have pronounced some of that correctly. This turns into the medical field, which I am not. Some of the web resources, finally, on slide 10 will include children and adults with attention deficit hyperactivity disorder, which the acronym for that is CHADD. Then we have the American Academy of Child and Adolescent Psychiatry. And then we have Center for Disease Control and Prevention. And then we have the National Center of Biotechnology Information, which is where I retrieved this article from. And finally, I thought this resource was interesting. It's not actually a website, but it's dedicated to providing evidence-based information about ADHD to the public. It's actually a 1-800 number that you can call. And when you call, you actually can speak with a health information specialist. So thank you very much. And that concludes my presentation.